session so that we can share it with those who couldn't attend. I'm also going to turn my camera off so that we can go through the PowerPoint without taking up too much bandwidth, which I have found is really difficult in the time lag that might happen. The presentation will be 15 to 20 minutes, and then we'll cover off any questions that you might have. So please use the chat, and we'll probably turn on the microphones at the after my presentation so that we can also chat if that's what is desired. Okay, so let me just stop video here and we'll proceed through this. I noticed, and I have to admit, I'm not sure, Jacques and Suzanne, how you answered this, but I do know that many who registered for this session, yesterday's and today's, indicated that they did have some awareness of 211. But all the same, I really want to sort of answer this initial question of what is 211. So 211 is a community navigation service. We use the most comprehensive standards-driven resource directory, and any of the data that we collect, both resource data and what we call contact data, that when combined with other data sets can be used in the community for service planning, storytelling on the needs and unmet needs of community residents. And I'm going to go into more depth on all three of these as on 211's core services. In Ontario, I'm not sure if you're aware, just a little segue here, 211 up until last month was really only available in Ontario, Nova Scotia, BC, and parts of Alberta and Saskatchewan. And more recently, 211 is now accessible to everybody across Canada. But I'm only going to be speaking to 211 in Ontario. So in Ontario, 211, it's a system comprised of 6 regional service providers, numerous data partners, and Ontario 211 Services, who are the stewards of the system. It started in 2002 in Toronto, and by 2011, 211 was accessible across Ontario to all residents. Provincial expansion was made possible through funding received from the Ministry of Children, Community and Social Services, United Ways, and local governments. Regional service providers are located in Thunder Bay, Collingwood, Windsor, St. Catharines, Toronto, and Ottawa. And I noticed, Jacques, you're from Ottawa-Vanier, so one of our contact centers are in your riding. And Susan, being in Hamilton, we have data partners in Hamilton, but anybody who dials 211 in the Hamilton area, their phone or chat or email are answered by one of the 6 regional service providers. Although 211 started as a phone number, it now has multiple channels of access. So you can dial 211 quite literally, like you would 911 or 411. And we sit somewhere in between there, in that we're not an emergency crisis line as you would think of 911. But we are more than just an operator or an automated system like people think of 411. So you can dial 211 anywhere across the province, 24 hours a day, 7 days a week, 365 days a year. But you can also chat with us from 7 a.m. to 9 p.m., Monday through Friday. Send us emails, get help at 211ontario.ca, and search our portal at 211ontario.ca as well. So all the channels of access are answered by community navigators, who are what we call resource specialists. They are trained in effective communication, and they're certified by the Alliance of Information and Referral Systems. So when a call comes in, the navigator will ask questions pertinent to the situation that's being presented. And that allows the navigator to really get at the crux of the matter, what it is that the caller is looking for. And we get calls across the spectrum, people looking for help with employment, with housing, food, income, mental health. Maybe they have a concern about the drug use of their teenager, or how to help their teenager navigate a new school. So really and truly, our 211 lines, we get presented with so many different situations, and it's not just a matter of calling and asking for the phone number for the local Employment Ontario office. The other strength of having a community navigator actually answer the call, and what we call a live answer, is through the conversation, we might find that what the person is presenting initially, they call and say they want an Employment Ontario Centre, help finding a job. What they're presenting initially, once we ask questions and do some probing, we might find out that they're actually looking for a second or a third job because they can't pay their utility bill or they're behind on their rent. So the navigator will help them prioritize and set a course of action for what to do first. The caller might also need someone to advocate on their behalf. And I want to stress that our community navigators cannot fast track anybody through wait lists, but they can work with the caller and the service agency to access the service that they require. The navigator may also offer follow-up in situations where the navigator feels that the caller may not act on the referral, or may have difficulty expressing what they want and what they're looking for when they reach the service, but the caller really wants to do it on their own. So the navigator will offer to do a follow-up in a week's time or 10 days time. And that way we can see how the referral worked for them, see if there were other needs that might have come up, or we've helped with that initial need, and now we can start working on those other second and third priorities. After all of that call or that chat or that email have been completed, the navigator will then complete what we call a contact report. And that collects basic demographic information, caller's needs, the referral that was provided. And where there couldn't be a referral provided, we then collect what we call an unmet need. Of course, in order to do this and to provide referrals, a database of services required. The 211 database contains information about the programs and services in Ontario. They include hours of operation, accessibility, application process, and eligibility requirements. Every record of information is indexed using a standard taxonomy of terms. And this is really important. This is really very much what sets our 211 database apart from a lot of other sort of data collection services, in that because we have a taxonomy, it's like a classification system. And for those of you who might use your public library and think the Dewey Decimal System, where there's a code on the spine of the book, so the librarian will know by subject where they can find a particular book. Our community navigators, because our records are indexed using a taxonomy, we can have somebody from Hamilton call in and have that call answered, and the questions asked, the probing done, and the referral found because of the taxonomy. So if a call comes in, let's say from Kapuskasing in Northern Ontario, it might ring first at the 211 North Contact Center. But if they're all occupied or on lines and they can't answer that person's call, that call will simultaneously and seamlessly go to the next available community navigator somewhere in the province. And we're really confident that community navigator, because they have those communication skills, those questioning skills, and because we have this database that is indexed in the way that it is, they will be able to help that person find the service that they're looking for. The data from the resource database is also used for many other portals. And a few examples of those are settlement.org for newcomers, and Ample Labs, who have developed the Chalmers bot for use by people who are experiencing homelessness. The third component of 211 that I spoke about was the reporting, where we share aggregate resource and contact data with service providers and decision makers to help them with planning when it comes to community investments, program planning, social policy. And what I'd like to do is just stop sharing this particular screen, and I'm going to share my other screen so that I can show you this live dashboard. Could I have somebody indicate to me that what they're seeing now is the live dashboard for 211?
It is.
Thanks very much. So this is, and we can send you the link for this, but this is what we call a live dashboard of all of the data that we collect on the contacts of the people who call or chat with 211. So you can see here, this dashboard is, the date range is the 1st of January, and it was last refreshed on December 3rd. It can be filtered by city, age, gender. We highlight the top 5 needs by category, and then these categories also coincide with our taxonomy that I spoke about earlier. You can drill down into these. So if I take a look at mental health and addictions, we can drill down further into the aspect and into the topic of mental health and addictions and see what need was identified by the person who was contacted 211. And if you recall, I also mentioned unmet needs. And this third screen here gives you the unmet need, also by category, top 5 unmet need, last refreshed December 3rd, and maybe of interest would be the reason that need was unmet. So it can be from no resource found to hours of operation or hours of the program. Person couldn't afford it, I'm sure is in here, cannot afford the service. So all of these unmet needs and the reason for the unmet needs are also documented. And if we go back to the first slide here, we can see that we can then see the demographics, very basic demographics of age, gender, language, the number of reports that came in by month. What you're seeing here is what we call the public dashboard. And this dashboard you can access anytime. Of course, remembering that in behind this dashboard, we have a lot of contact data, and we provide contact data to planners that we can help them in determining what pieces of data they need and how we might be able to combine pieces of data so that they can overlay it on whatever it is that they might be doing. And I'll speak a bit to that when I talk about our various partnerships that we have and how our partners might use our contact data for their planning purposes. So going back to my screen 1 and the PowerPoint, again, Carrie, could you just confirm for me that you're seeing the PowerPoint 3
Yes.
reporting?
Yep, looks great.
Thanks so much, Carrie. I never know with technology whether I'm actually just talking about something and nobody else can really see it. So I appreciate knowing. Thank you. I did speak about 211 and how we have a lot of partnerships. And 211, we really are powered by partnership. Our partnerships all take on different ways of utilizing 211, but all of them use some aspect of one of the core services that I spoke about. So for example, we have in the middle here, the Ontario Caregiver Organization. Well, their helpline, they're a relatively new service for caregivers, but their helpline and chat service are answered by 211 community navigators. And those community navigators that answer that helpline also use the 211 resource database to guide caregivers in what it is that they might be looking for. And every month we provide back to the Ontario Caregiver Organization, we report back to them what it was that caregivers were looking for, what their needs are, and what their unmet needs are for their planning purposes. Another one is Feed Ontario right here. Feed Ontario used 211 contact data as it relates to food insecurity to help with their service planning and food bank planning. And then more recently, the Ontario Psychological Association up here, they advertised 211 as the number for frontline workers who were impacted by COVID but didn't have extended health benefits. They could call 211 and we would register them for 6 free sessions with a psychologist. So this was an easy way for the Ontario Psychological Association to get their message out. And it was a way for us and for our community navigators to find a service for those individuals that were looking for mental health and psychological services, particularly through this difficult time with the pandemic. Other provincial services that use 211 are Good to Talk. This Good to Talk is right here, and that is a helpline, a mental health and well-being line for post-secondary students. And the front door for that line, the 1-866-925-5454, it is answered by 211 community navigators. And that way the 211 community navigator can diffuse the situation that the caller is coming in with. So if they're in high anxiety or crying, we can calm them before we put them into the queue and wait to speak to a counselor at Kids Help Phone. And not all callers to Good to Talk are looking for counseling. Some of them are looking for the OSAP office, or how do they help a friend that might have an addiction issue, or they're concerned about a friend that may have other issues. So we're the front door for Good to Talk. We're also the intake center for Report On, which is a helpline that reports abuse or neglect of adults with a developmental disability. And we take the report on those alleged, suspected, or witnessed abuse situations. And more recently, the Chat for Victim Services through the Ministry of the Attorney General, they recognize that with COVID, victims of crime might need a non-verbal means to access information and referral to services while they were in their home and complying with the stay-home orders. And so very quickly, we were able to set up our chat so that the ministry could put onto their materials and their communications that for chat, they could reach out. So those are just a few of the examples of some of the partnerships that we have. And we're really pleased to be part of every single one of these. And I know I've also missed a few. So if you'd like to know more about partnerships, again, please reach out to us. We've developed a number of tools that can be used by you to assist your constituents, and we encourage you to share these tools with your constituents and on your social media if that's appropriate for you. If you have any questions about these tools or the ones that were sent to you by email in November, please let me know and we can either discuss that or have an exchange via email. And if for any reason you can't find that email that was sent to you in November that had all of the tools attached, don't worry, reach out, I will resend. I'm sure, like many of us, your email inbox is getting crowded, more and more crowded every day. So I have no problem resending that to you. So in summary, 211, it's a public utility. It's free for you and your constituents to use. You can call us on behalf of your constituent. If you have a constituent showing up or calling you about an issue, by all means, call on their behalf or give them our phone number and access points and they can phone us themselves. 211 resource database, it's province-wide, standards-driven, up-to-date, and is utilized by a lot of our partners on their websites and in ways that are customized for their subjects. And we do the reporting, providing aggregate de-identified data of client need and unmet need. It can be filtered on our public dashboard. And when combined with other data sets, we really can tell a compelling story of situations and how people are being served and how needs are being met or unmet in Ontario. So that's it for me. And I'm sorry I haven't been keeping up on the chat there, Carrie. I don't know whether there's been questions that have come in that you can share with us and we can answer.
We haven't had any questions except just a request for the PDFs, which we'll send out for sure.
Yeah.
So maybe if there's time for questions now, if people have any.
I would like to say before we all ring off that if you're looking for community information, government, social services, dial 211. Please don't reach out to me specifically for that type of information. I'm not a community navigator, and our community navigators are highly skilled to ask you the right questions to actually help you find the most appropriate service for you in your community. But if you have any questions about 211, about this presentation, or any of the items in the toolkit, please reach out to me at jroddy@211ontario.ca.
We have a couple of questions from Susan.
Yep.
The first is, how can you assist constituents who may not be able to read? And that may be a good time to talk about language as well.
Yeah.
And the second is, can you follow up with people in person, pre-COVID and after COVID?
So both really good questions, Susan. So our service is predominantly a phone service. So if a person can't read, then they can certainly reach out to us by phone, and again, dial 211. We also, as Carrie said, we are a bilingual service. So we call ourselves Live Answer, but when you first dial 211, you will be asked your language of choice, whether that be French, English, or another language. And if you are looking for French, you go to our bilingual center in Ottawa. And if you're English, then you come into our integrated center, as we call it. All of our community navigators have access to over 150 other languages through real-time interpretation. And we can bring the real-time interpreters onto the line in a matter of minutes. It really is, I think, on average, about a minute, maybe a few seconds more, so that the conversation and the exchange can be done in the language of choice of the caller. With respect to whether we follow up with people in person, we don't. We are a phone chat, email, and web portal service. But we do have in the database, amongst the resources that we can refer somebody to, there are services that will help clients with things like completing forms, filling taxes, and even friendly visiting. Now, mind you, with COVID, there's certainly restrictions on all of that, and those services are very limited. But after COVID and pre-COVID, those services were abundant, and we're hopeful, of course, that those kinds of services continue.
We have one more question from Angie. She's wondering if 211 is accessible for the hard of hearing or deaf constituents.
Yeah, really good question, Angie. We do have a TTY, but I will tell you that our TTY it's not utilized. And when we spoke to some of the agencies that serve the deaf and hard of hearing about that, we were informed that a TTY, the person sending the message actually had to have some special kind of instrument or tool to do that. And so that email and chat, and we're soon introducing text, were all ways that would actually cover that off. So if it is for somebody who is hard of hearing or deaf, then we can certainly engage with them via chat or any of the written means. And again, we do have services in the database that will serve people who are deaf and hard of hearing. So we can engage third party to help if that is what is required. Any other
that's all the
questions?
questions we have for now. Sorry, Jackie, I didn't mean to interrupt you.
No, that's great. Thank you. Okay, so not hearing any other questions and it being 12:26 and promising that we would be done by 12:30, I want to thank everybody for joining us today. We will follow up. We will follow up with you by sending out this recording, and we'll include the items that were included in that November email on toolkits. And if you, suddenly have I should have asked this question moment, by all means, send me the question and we will attempt to answer it. But if it's a question about services in your community, please reach out to 211. Sorry, I see another question here. Do you have a liaison line in case we need to refer constituents to your service? If you need to refer constituents, refer them to 211. So 211 would be the best way for anybody to reach us to ask or seek services that they're looking for. You're welcome. Susan has said, okay, thank you. Okay, thank you, everybody. And again, please reach out should there be any other questions that arise for you as we over the coming weeks that you're looking for answers, you have any concerns.